Hello everybody, and welcome to my third episode here on the plant-based weight loss YouTube video blog. And a warning up front with this one and any subsequent parts I might need to make. If I can't fit all this into my allotted 15 minutes, I'm definitely going to try, but there are going to be some very graphic verbal descriptions of wounds which I have had on my primarily left leg and left foot, along with the improvements that I've seen in what really kind of looked like what was crossing over into the get ready for amputation territory back when I was close to 500 pounds. So if you don't want to hear about nasty wounds, you're not into watching The Walking Dead, get out of here now. But if you're somebody suffering from this kind of condition, then I will want to be discussing what I think is a very effective treatment above and beyond the McDougall plan eating lifestyle for helping wounds to heal. Obviously, with the McDougall type of diet without any added fat, based around starches and foods that the body can easily burn off, you're not going to have your blood sludging from excess dietary fat consumption. And what this allows is for better circulation, especially in the capillaries up near the surface of the skin. And this improved circulation can help to heal wounds. What I had on my leg and on my foot was the culmination of a problem that started the exact same week I was going down to meet my wife in Arizona, my wife-to-be at that time, for our first get-together. And I can still remember calling her from the doctor's office when the skin on my left shin had opened up and was leaking clear fluid, which is how this problem begins for most people with diabetes or bad circulation or edema or lymphedema or any combination of those four, take your pick. And I was terrified, and I was of the impression that I would probably end up giving Jeanette a call on my cell phone from the doctor's office that night, explaining what was going wrong and having her want to cancel our plans. And this was, you know, at the point where I knew that I needed to go meet this person, and I had to go down there. And it, you know, if I ended up not able to do it, I'd have been crushed. But I called and explained, and her reaction was, well, my mom's a nurse and she's taught me a lot of things. I don't care what's wrong. Get whatever the doctor wants you to have to treat this and come down anyway. And so, you know, there in my hotel room over the weekend, when I had to bandage and unbandage and try to treat this first shin ulcer and the swelling in my leg from all the fluid retention which had been starting to build up, she helped me, and I was very amazed that someone who was still, you know, in many ways a stranger at that point, who I was only seeing face to face for the first time, would want to invest in trying to help me out. And you know, needless to say, here it is. How many years now? 10? Yeah, I met you in 02, right?
Yeah. It's not quite 10.
Yeah, this summer it'll be 10 years, and here we are, you know, still together through all of this crap that I've been having to live with. So anyway, that's when the whole problem started. Now, By the time I was about to lose the insurance that I had, because Jeanette ended up losing her job where we had insurance coverage, I was down only very slightly from my maximum weight, in the high 400s, probably about 480, 490. And every time I went to the hospital, and I'll talk about this stuff in another video, but I had 4 lengthy hospitalizations for these ulcers and infections, plus trips all over the place for outpatient wound care, and it was just a never-ending fight, and just trying to haul my fat body, to all this stuff, with so much pain all over, just trying to be able to walk or use my, I had a big Giant brand bicycle. That's a subsidiary of Schwinn, I think, that I would use to pedal my way from bus stops to buildings and stuff like that. And it was just horrendous. But anyway, enough backstory for now. What I had after my insurance had lapsed and I was stuck here at home, and we were only living on her income at that point. She hadn't quite... Wait a minute. How was it, hon? Yeah, that's right. I was on disability, so you were out of work and we were living on disability, right? My disability.
From April 2010. Yeah. No. Are you talking about when I first lost the job?
Yeah, that was in...
I was getting... you were getting disability. You had just gotten your disability check, and I was getting...
unemployment? Okay, yeah. Anyway, what I had was my left leg. Let's pretend that, this is the leg, and down here at my elbow is the foot. This is kind of backwards, but right along here where the shin bone was, running at a very slight angle, was a wound which was literally a trench, which was about the outer ridges of it stuck up probably about ½ an inch, and then down into the thing it was close to ½ to 3/4 of an inch deep, and the bone wasn't exposed or anything like that, but it was a very angry red, and all of the tissue around it was red, and then on top of that, ringing this trench-like wound in a kind of an equilateral triangle were 3 roughly $50 to silver dollar sized ulcerated wounds, which were very angry, and the surface of them was pretty much black. It wasn't even red, and when you unbandaged me you could just watch the really nasty discharge coming out of this. And yeah, this is horrible to even have to sit here and talk about, because now that more than 80% of this is completely gone, it seems so surreal. But anyway, moving on, down on my foot in the toes, my big toe, where the webbing was between the big and second toe, was the same way, completely ulcerated, dark, on the surface anyway. And the second toe had a indented band around the middle knuckle, which it looked like I was kind of wearing a really tight black ring around that second toe at the middle knuckle joint. and there was a lot of swelling. Also, the top of the foot, thank goodness, never the bottom, or I would not have been able to get up and move at all. But much of the top of the foot was also ulcerated. And what this left me with was a condition where I had to be rebandaged every 2 or 3 days, or the whole thing just became a disgusting mess. And I was living in terror, uninsured, didn't know who I could turn to, didn't know who I could talk to, didn't know where I could go. And what I suggest you do, if you've never faced this kind of problem, just spend a minute meditating on that. When you're afraid that you're about to lose a limb and don't even know how you're going to get it cut off or what they're going to do. And so that was my situation. And I decided I had to do something on my own. I wasn't going to quit. You know, I had too many reasons to still be here, with or without 2 legs and 2 feet. So that's when I went McDougal and started eating the plant-based and the starches and cutting out all the added fat and the butter and the margarine and all the other junk. And then there was also a suggestion by somebody else on the McDougal forums, a very nice lady who happens to live here in town and with whom I've visited a couple of times. She said, and also scattered anecdotal evidence on the internet said, that coconut oil has strong antibiotic properties and is an amazing healing agent, both internally and externally. So we went ahead and decided to start using coconut oil on my skin with every cleaning and bandaging and treatment which Jeanette would do to try and, just keep this mess, from getting any worse. And on day 0, I was seriously thinking about trying to find a ride to the hospital to use my Medicare Part A and throw myself at the mercy of what would have undoubtedly been bare minimum standards of medical care, because when you get Medicare Part A, there's not a lot of profit in those patients without Medicare Part B or other insurance to pick up the slack. And so they're kind of the impression that they'll just stabilize you and you can be on your way. It really is like that in a lot of cases. But Jeanette was like, look, let's just try this for a couple weeks. And as long as you don't get to the point where you're so sick that you can't function at all, let's just go with it. And so we did. And my weight started to come down, and there's no question that a lot of what improvement I had was due to the diet and due to improved circulation in this tattered leg I had. But there's no question that I had surface infections, bad ones, because as I said, I'd already had 4 long hospitalizations for these infections, which I'll get into another time. But over time, over the course of weeks, things actually started to look better, and the rate of discharge started to decrease, and the size and severity of the wounds began to change. And I'm going to go ahead now. We've got 20 seconds left before the 15-minute timer expires. I'm going to stop this now and continue in a part 2 to bring the situation up to where I am today. So give me a moment and I will return with part 2. If you stuck through this horrid graphic stuff out of morbid curiosity or otherwise, then congratulations. And hopefully there won't be much more of this that I'll have to do here in the channel. Thank you.